You got it.
Welcome back to the Hot Flash Diaries. This is episode 3, where we are continuing our conversation with Dr. Maureen Slattery from Rochester, New York. In case you missed episode number 2, you need to go back and listen to it because it's pretty fabulous. Dr. Slattery is an board certified OBGYN with over 20 years of clinical experience, and she is also a certified menopause practitioner, sex educator, and a certified sexuality counselor. So she is the woman we need to talk to about all things libido. We really dissected libido and what that sort of means and how it's multifactorial. And there's so many different aspects and components to libido that are very personalized for each person and each couple or each group of people, if that's what you're into. And so now with episode 3, what we want to dive into is some solutions and action points that you can sort of take away. And how do you sort of reframe mindset, some communication tips, and just some practical solutions and action points that you can take away. So thank you again, Dr. Slattery, for being here with us today.
You're welcome. It's my pleasure. I enjoy talking about all things sex. So I am super happy to be here.
Oh, well, thank you so much. You're amazing. So in episode 2, again, we really talked a lot about mindset with libido, right? So it's not something where "Oh, my testosterone is low. Please check my testosterone. Let's replace this magic, topical testosterone." And then all of a sudden you've turned back the clock and you're 20 years ago or 20 years young and you just want to have sex every 5 minutes. It doesn't work that way. There's so many different bits and pieces to libido. And one of them is that psychological component, your mindset and where you're at with things. How do women think differently about desire and intimacy in midlife, or how should they think differently?
Well, some of it has to do, I think, like longer term relationships are pretty common when you get to midlife, and they're kind of their own like animal and like their own beast. But I mean, I want people to like, my goal is always to help people, but I also am a realist. I'll say this: my glass isn't half full, my glass isn't half empty. It's like 50%. So I try to remind people that, like, again, we are aging. We have this funky process that we go through in midlife that men can't understand, and like most of the world, including us women, are not educated about. But unfortunately, if we live, if we're going to live through it, and things are going to be different. So remembering that there are going to be some biological changes on top of like whatever's going on in your life. Like I have a kid at home who is 14 who is going through puberty, which is a whole different ballgame to me going through like menopause. So there's always other stuff kind of going on. And then most important, I think, is to just, is to change your focus, I think, because you may have a dry vagina. It may not be as dry as your friends, and it may be too dry for you. And so you fix it. But you are going to have changes in how you feel about sex or sexuality. You may notice that you don't have an interest as much, and that might be okay with you. It might not be okay with your relationship. Like, I try to normalize it the best I can and try to tell people what to expect, but tell them that they don't have to settle for like the absence of it too, right? Like if we change our whole focus on away from desire, and I feel like this too, right? Like you might not be hungry, but you can still eat. And not to say that like I want someone to do something they don't want to do, but if we shift the focus to at least giving pleasure and intimacy kind of an equal playing field, despite all the other midlife hassle crap that we all have to go through, it changes the intention of how we look at and go into any sexual episodes with our partner. The other thing that we need to do is talk about it, because when things change, and we just kind of dissected how men don't really know, if you have a partner who's a male, like you might need to educate them. Hopefully they'll be willing to listen. But there's a whole lot of change that we can accept and embrace if we aren't just mad that it's happening in the first place. You know what I mean? Like I'm
For
mad,
sure.
but it's like it's reality. So here we go, right? Like now I'm going to deal with like my vaginal estrogen cream. It's not sexy, but it helps.
Absolutely. And that's exactly it. I actually started this season off by saying that personally, I'm not going to look at these changes that are happening in midlife. I mean, I'm almost 43, so I'm early on in my trajectory, if you will, but I am definitely seeing changes. And I'm not going to look at them as something that's happening to me, but rather something that is the beginning of a transformation, right?
Yes.
And just like you did in puberty, I mean, nobody, if I bet if we asked everybody who's listening to this podcast right now, would you go back and be a girl or a young lady going through puberty right now versus like just living your best life right now as best as you can, even if you're progesterone and testosterone deficient? No one's going to say yes to that. Nobody wants to turn back the clock and be
No,
14 again. Like it
no.
sucks to have a 14-year-old girl. And I'm telling you, man, it is a
Yeah,
whole ball of wax. And you kind of forget what it's like because, you're so many years out of it and it sucks. And so,
yeah,
but we don't have to look at it from that perspective. Like we've been there, we've done that. We have so many decades of experience. So now let's
yeah.
take that
Fully
and really, yeah, fully,
fully
fully,
developed frontal lobe. Like, could you imagine if you could do puberty with like a fully developed frontal lobe? It probably wouldn't be as bad because you have,
honestly, that's something that I have on recording in my brain every time something happens because we actually have 3 teenagers.
God.
And every time they do something where you're like, "What?" And
Mm-hmm.
then I'll say it or John will say it, frontal lobe is not developed. Frontal
Mm-hmm.
lobe is not fully developed, right? Like
Yeah.
it's just this constant recording and it's like, okay,
My,
that makes you feel better. It's very
yeah.
validating, right?
Even my 18-year-old who's grown up, you're like, there's still some things because she's away at college or university, as you guys like to say. And she'll like still do things where I'm like, all right, couple more years. She's made
She's
strides, but
almost
like
there.
it's still not there.
Yeah. Yeah, it's true. So I guess you're just really reshaping. It's a different phase like that. When you think of your relationships, nobody stays in the honeymoon phase very long. And
No,
if you're somebody who is divorced, remarried, or in another serious relationship, from my perspective, I felt like the honeymoon phase with John was a lot shorter. And that's not because John's a wonderful guy. Obviously, I'm with him. But it's not the same as when you're younger. It's like your hormones are different. There's more adulting responsibilities. There is just no way that you can walk around with these butterflies in your belly and just feeling so excited all the time. Life comes for you and it's not kind.
no.
But we have to look at it from a perspective that it can improve and it can be better, but we just have to be realistic about the expectations as well, right?
Yeah, part of that too, and Esther Perel talks about this in some of her books, kind of looking at like what happens to sex when people are having sexual health problems from a therapist standpoint. But she talks about how, in order to have that honeymoon phase, right, to have that excitement, I mean, it's like a dopamine driven fun part that happens. It's called new relationship energy. And you can get it
Totally.
for like up to what, a year and a half, sometimes longer if it's a long distance relationship. But the key with like a long-term relationship is you can't have the unpredictable and the exciting all the time because it's basically contradictory to how we need to settle together to like raise children, run a household. Like you need someone who's going to hold your hair back when you puke, not someone who's just going to show up surprised in like a thong and be like, "Hey, it's time to go." You
Right.
you have to like these two things have to coexist. And so some of that down-regulated dopamine, the stuff that makes it exciting or almost addicting, and all of that mystery and surprise and excitement and unpredictability that makes sex good, which is not testosterone, right? It's just everything else. Like sometimes we have to recreate that in small ways because that's going to go away, but you wouldn't want to marry someone who you didn't know if they were coming home or you didn't know if they were going
For
to,
sure.
like we need to marry these two things. We need some excitement and unpredictability and eroticism with like, managing a household and running, taking care of kids and doing your day-to-day life. They have to have a balance, but we oftentimes, as time goes on, forget about the excitement stuff. Like we can find ways to reintroduce that. And I think that is one thing I try to talk to patients about, right? Like a lot of us middle-aged Gen Xers like didn't have a cell phone. I mean, until we were in our 20s, 30s. I don't think I had an
For
iPhone till
sure.
2011, right? I was in my late 30s. So that in and of itself, like you can find a secure channel and you can sext your partner. You can even send them nudes if you're using something that's like end to end encrypted. Like you can make things fun and interesting again if you try and if you want to, and if that's something that makes you excited. But there are avenues to go down to get rid of all of the mundane and try to reintroduce some fun.
For sure. And realizing that there is something sexy about that consistency too, right? Like the person in your life who cleans out the drains and does the grocery shopping and
Matt does the
takes the
laundry.
dog for a walk and puts the
Yeah.
garbage out. All of that stuff is like, it's not sexy, but hey, it's consistent. And it's something that, again, it's like one thing that maybe you didn't have
You
to
didn't have
do.
to do. Yeah.
Exactly. And then you could use that time for something else, right? Whether that's self exploration, going to yoga class, or whatever you want to do for yourself. It's like that in and of itself is sexy.
That's
It's
sexy and a
really,
gift. Yeah.
yeah, yeah. So I think it's really important to reframe that too. I agree with you. It's really our mindset, as you said in the first episode or our last episode. The brain is the biggest sex organ, and if we don't control it, it will control us. And so we need to know that.
Yeah, absolutely.
Yeah. So we talked a lot in the last episode too about the physical pieces. So we've chatted a little bit about the testosterone piece, and we know that it's unlikely that any woman, in her 40s and 50s and definitely not in her 60s is going to have a normal testosterone or an optimal testosterone. That's
Yeah.
for sure. I
No,
try not to use the word normal. I think optimal is a better word.
that's a great word.
But even when it's replaced, I've had women who have, hypo or sexual desire disorder
Mhm.
where I'm replacing the testosterone, or hypoactive is what I was trying to say, sexual desire disorder.
Yeah.
That's perimenopause acting out in the middle of our podcast recording. So when we put them on testosterone, they might have like a bit of a placebo effect initially, which we know that if we replace testosterone, it usually takes about 4 or 5 months to really see a change. Would you agree with that?
Oh, no, absolutely. In fact, I tell people when I'm using like estrogen that it's going to take like 6 to 8 weeks to get to a steady state. And even with like transdermal estrogen, women get to the same like little like MHT, not like vaginal estrogen. They'll get to this like they get this bump where they're like, "Oh my god, was I like asleep? Like what the hell? I felt so horrible and now I feel good." But then they feel not quite as good about 2 months out. And that's normal. That means they may need a dose adjustment. But even thyroid hormone, right? Like you need to wait like 3 months and see where you're at. I do find that people who stick with testosterone when they go to use it, I make sure they're not like super, like super therapeutic because they're like crazy absorbers of it. But it does take 4 to 6 months. So like even when they should be at more of a hormonal steady state at about 3 months, I tell them to try to stick with it. If you're going to do it, probably give it 6 months. Let's see where it goes because, there are definitely, people find that there's other benefits, but it's not fast. None of the hormonal kind of adjustment stuff is. So it takes a while. So I
For
agree with you.
sure.
Yeah.
Yeah, and so it is definitely something that can be replaced, but is not the end all and be all. It's not the magic potion that's going to make you want to have sex all the time. Progesterone, we chatted about as well, is great in terms of helping with the sleep and the mood
Mood. Yep.
component. If you're feeling super anxious or depressed and not sleeping well, you're not going to want to have sex. I actually tell people, if you are so tired and your cortisol's through the roof because you haven't slept well,
Hmm.
think back to our primitive, days when, you're basically your body was feeling like you're being chased by a lion or a
Right.
tiger. And like you're going to pull over and say, okay, caveman, let's go at it. Not a chance. Like that's not happening. Your body is shut down and it's saying, no, thank you. This is not the time to procreate. You're in danger.
Right.
So it's really no different. And so we really have to focus on trying to get our sleep under control so that we're feeling more rested. Our nervous system is calmer. And so in that case, then our body is able to function the way it's supposed to. And our brain is not constantly sending, danger signals down the neural pathways.
Yeah. And I feel too, like I talk to women a lot about like boundaries. If you can set some boundaries so that your time and your energy is protected, that is helpful because I feel like there are so many things in today's society where our nervous system is ramped up like that all the time. Like even scrolling this past week, I was like, I
Goodness.
can't look at any more of this stuff. I mean, in the US, I know I apologize. I'm from the US. Like it's a disaster here right now.
Don't be sorry. It's okay.
I want to move, but at any rate,
We'll
it's
take you.
thank you. I'm only about 2 hour, no, an hour from Niagara Falls, so
Easy enough. Easy
easy
move.
enough. Yeah, yeah. I could come up and have dinner with you guys anytime.
I'd love that.
Yeah, no, I'm happy to do it. But I feel like there are so many things now in our day to day, besides just having busy schedules and, work stresses. And I feel like even with, I was talking to somebody about this today, work, you can't even put up boundaries. There's so many jobs now that expect you to be on 24/7, even when they say you're not. So, like, you've got weekend. Like, I had a friend that shut off their email because they were like, I need 24 hours. Like, I can't be expected all day Saturday and all day Sunday to either like have some weird email hanging over my head and feel like I need to go do that when I'm supposed to be with my family. or just like, take all of these emails all day long because even if everybody is only working for 2 hours on the weekend, none of those 2 hours might line up. And then you're just getting like a barrage of stuff. It's like, how can you turn off your nervous system? You can't. And there are just so many more ways in which through scrolling and work and other things where we can't stop it, we can't say no, and that you are exactly right. If you're in fight, flight, or flee, if you're in your basement brain, you are not going to be able to do anything else. Like you really aren't, or not with, enjoyment or style. Like it's not, it doesn't work that way. Um,
Exactly. That's exactly it. And it's tough. It's tough to put up boundaries, but it needs to be done. Time needs to be carved out in your schedule as well for those important things like connection time with a partner and, family time, all of those things that fill your cup, if you will. That is what's really going to settle your nervous system and make you feel more like yourself again and feel like you want to partake in things like being intimate. If you're not doing those things, then you're not going to enjoy. And I think from our last episode, one thing that you were saying was, if you've stopped, doing the things that you enjoy. So if you used
yeah.
to go to an art class or like a particular like yoga class or what have you, and you stop doing that, then you need to find joy.
Hmm.
And so even carving out, start slow, like twice a month, putting that
Yeah.
into your schedule and it's non-negotiable of attending whatever it is that you want to do that brings you happiness, then do those things because that's going to benefit all aspects of your life.
Yes, 100%. And I sometimes just give that as homework for people. I'm like, you know what? Get back in touch. Even if you don't start, think about what you used to love to do. See if there's anything you would love to try that's new. But we need to start thinking about getting you some time. In the exam room, I used to ask people, like, are you getting any exercise? And now I ask all women, and especially women who are like, 30 on up, like, what are you doing for you? Are you doing anything to take care of your emotional health or your physical health, but what are you doing for you? I even say to them, do you lock yourself in the bathroom for 20 minutes so no one bothers you? Because even when my kids stop bothering me, my dog bothers me in the bathroom, like my cat
Yes.
bothers me in the bathroom. And, that's important. And they all laugh. And I'm like, but that might be the only, 10 minutes you get a day. So if that's the case, what are you going to do for you? Because I feel like in this day and age, that is becoming more and more and more important.
For sure, for sure. And especially because, being on our phones and that constant need to be entertained, we see it a lot in kids and teenagers in particular. Like our household, we have some pretty strict guidelines as far as screen time because they turn into monsters when they're exposed. But I know myself,
Yeah,
like if I'm sitting there and I'm just like scrolling at bedtime, when that 10 minutes could have been used to do some stretching or like a hot Epsom salt bath or something before going to bed, and I would have slept so much better than my brain being stimulated by all the garbage that's on social media.
right?
And yet, we get sucked into it. So I'm really a big fan of putting stuff into my schedule. I worked a little bit with a personal trainer who is a big fan of that. And I thought, you know what, that makes sense because it's protected time. And then, when your staff or your team or patients are looking at booking, it's like that has been blocked off and it's a non negotiable. And when you actually action on it and do the
Mhm.
thing that you wanted to do in that time, you feel liberated. You feel so good that you actually did it for you. And then you're a better human for everybody around you. So there's a lot to it. And it's also helping to regulate your hormones and doing all kinds of stuff, right? Like it's
Yeah.
all intertwined. It's not, just one singular thing that we can do to improve how we feel. It's really multifactorial.
Yeah, and I would say that it is sexy in some ways to schedule the sex, and I know people don't love that, like, they're like, "Ugh." But honestly, if you don't carve it out and you have 3 kids, you're running 7 different places, and you both have full-time jobs, and there is a pet, and there's life going on. If you don't
Mhm.
schedule out that time to potentially include sex, it probably will not happen. And the cool thing about scheduling it, which, seems unsexy, is that you can build anticipation just like when you were dating. You can get out the phone and send a sexy message. You can start to be like, you can talk about it. I'm so looking forward to like when we get to go out alone and the kids are staying at grandma's on Friday. Like
Yes.
you can build it to be something that helps with, getting the sex you want and the sex that is kind of worthy of having, because even just scheduling it and building anticipation is going to make it better. You don't have to It's like, there's time for it. You can look forward to it. That's
For
not a
sure.
failure. I mean, lube's not a failure. Scheduled sex is not a failure. All of these things are,
Well, especially when you're living in like an household or living a lifestyle. And certainly we're living in an era where spontaneity is just not a thing anymore because nobody's got time. Your schedule is chock full. There's so much going on that we don't even have the time, the downtime to allow for spontaneity. So if we can put it in the schedule, there's a better chance that it's going to happen than not happen, right?
yeah, yeah, absolutely.
And so the other thing that we talked a lot about initially was also that communication piece in the relationship,
Yeah.
and how to sort of communicate with our partner to bring up that, this is an issue. You and I have both seen patients who've come in and they've got discomfort, they've got different things going on. And while we can really help with vaginal hormones, external vaginal hormone, vulvar hormones, that kind of stuff is really, really helpful for lubrication and that overall sensation piece. The conversation needs to be had with partners around what's going on. And so how do you think that a woman should approach that conversation with their partner?
Well, the menopause transition and the physical changes, I feel like are easier, and I feel like women struggle a little less, especially after they've seen me and I've validated what's going on, and I've usually given them like a list of moisturizers and an actual prescription for something to treat the, genitourinary syndrome of menopause. And I honestly tell them, like, if you really want to, like, if he doesn't believe you, bring him with you next time. I am happy, or the female partners usually get it when women have a female partner, but like, bring him with you. I'm
Mhm.
happy to explain it that, there's a lot of education that needs to go on. I mean, remember, like, at least in the US, and I don't know how much this carried over into Canada, but for a good 20 years, I mean, people just wouldn't. I mean, a lot of providers are 20 years behind on information, but it wasn't talked about. So if it like 20 years of women kind of had to just suffer in silence, and no one around them was talking about it either. If they had hot flashes, like you said, people would realize something's happening, like they're about to stop having periods. But all the rest of it was just kind of like swept under the rug. And people weren't really doing anything for women who were struggling through this stuff. So bringing the partner in and letting them know, at least from the medical side of things, is easy. For the sexual side of changes and things that happen, sometimes that's a harder conversation. And I also tell them, bring your partner if you want. Come back and bring your partner, because I am happy to be the one to talk about it. Another famous thing that I'm known for saying is, we would rather have sex with someone than talk about the sex we're having. And I usually use the F word in front of my patients because that's how I am. I say this like, and I preface it like I'm going to swear, but you just have to follow the gist of it because it has more impact. Because we would, I mean, even when we were younger and things were fun and we had less cares about, how things were functioning, and everything kind of felt good most of the time, and you had less work and other things on your plate. I mean, I always tell people, like, we would rather just do it and we don't want to talk about it. And that's how we get into these places where it may not be meeting our needs, or it hurts, or it's changed, or, I don't want to do it every day anymore. Or I need you to do the laundry so that I don't have to do everything. Like, the conversation is hard. Keys for talking about sex or menopause or sex in menopause are really like finding the time, again, scheduling, when you are not stressed out, if you are not exhausted, when you have the time to talk, when someone's not going to get pulled away, and then honestly owning it. I mean, being like, I want to talk about what's going on with me. I saw the doctor. I'm having these medical issues right now. We can fix it, but it might take time. In addition to the physical changes, there are some emotional changes. And, we haven't talked about our sex life in a long time. You can do anything you want. I love you. I need you. I think our sex is good, but I would like to try something new, or I would like to not be pressured into it, or I would like you to consider that, like, I haven't had an orgasm. Those kinds of things, if you own it, if you don't own necessarily their reaction, they can take it well or not. But if you own it, you're at least expressing what you need and how you feel. So owning
For
it and
sure.
doing it in a time when you're not stressed is probably the most important. But talking about both of those things is of the utmost importance, really, to have a good relationship going forward.
That is great advice and great information because you're right. There's no worse time to have a conversation about a sensitive topic than when you're fired up and angry, because inevitably something is going to be said in a less tasteful way
Absolutely,
or less gentle way than
right?
when you're calm and not feeling stressed. And
Or if
and
you have
again, the last thing.
if you have 5 minutes and you have to, like, get somewhere, also not the time, right? If you're
No,
driving in a
exactly.
car alone for, like, an hour, that might be a time because no one can go anywhere. But it has
Yes,
to also be mutually okay for that person. That person has to be, like, not stressed and not distracted, to have the conversation too. So it has
for
to be
sure.
mutually, like, agreed upon good time so that you can give it the importance, that it should have in
Yeah, it
the
deserves, for
time.
sure.
Yeah, yeah.
Yeah. It's interesting that you say that in a car. We have often been told when it comes to the teenagers that that's the best time to talk to them because they're sort of
Captive.
captured for yeah, they're
And you
captive.
don't have to make eye contact, which for some people is hard at baseline. But when you're talking about your sex and your body parts and how they're not working or what
Oh
you
my
need,
goodness.
even
Yeah,
harder, even
for
harder
sure.
to have that conversation with like direct eye contact the entire time.
For
So
sure.
if you don't think you can do the direct eye contact thing, if the car is not a bad time to try it, uh, it's just one of the many things that you could or places that you could try to have the
That you can
conversation.
try.
You're captive.
Exactly. And so, what are some things that you would recommend in couples who really want to maintain their intimacy when the desire is low? What are some things that couples can do?
Well, we talked about this last time, but making sure you know your body as it changes and what feels good and what doesn't. I have commonly hear from women that, they really can't have an orgasm during penetration if they were able to in the past, which not a lot of women can, but they feel like they need clitoral stimulation. And if that part of all of the fun that sex is gets overlooked or neglected or not, treated as important, then the sex is not gonna be as great.
Just in terms of what couples can do to sort of maintain that intimacy when
Yeah.
desire's low.
Yeah, so there's that, right? So, like, know what you need now and know if things have changed. Your partner needs to know because they may not know. You can also, like, try and I always tell people to, like, be inventive and try new things, and new things do not have to be, you know, being tied up to the bed and getting out things for impact play, right? They don't need to be, having sex in
Elaborate.
public. It doesn't have to be elaborate. But the one thing that when people are like their mind is elsewhere during sex and they're trying not to have it be elsewhere because they really do want to be invested in what's going on and not making a grocery list, I tell them to go back to what they feel. And one of the better ways to do that is to just, if you have time and you don't have an agenda, like do things differently, blindfold each other, take turns touching each other in different ways with like your fingernails or your hands or your mouth and see how that feels. Touch different parts of your body. I mean, one of the nicest places, I love it when someone like touches my forearm. It's just like, it feels so good. And it's a random thing that people don't think about. But like, if you take away some of your senses and have to allow your brain to focus on what you're feeling, it's way more erotic and exciting and interesting and different. And you might learn new things that feel good. So one of the things that you can do that's simple is to just, maybe use a blindfold or maybe get some ice cubes or maybe just do something very small that might be different or do things in a completely different order. I talk a lot about boring married sex, and it's not just marriage. It's like long-term relationship sex. Do it differently. Don't undress yourselves. Get undressed, like undress your partner again, like, back when you were like, ripping each other's clothes off. Change things ever so slightly. It doesn't need to be catastrophically, like mind, blowing, earth shatteringly different, but there are small differences that wake up the dopamine in your brain again and make it
For
feel
sure.
good or bring your focus back to what you're feeling. And then you can try something new. I mean, there's always other fun, small things you can do, like bring a toy in, bring a plug in, I mean, there are lots of small things that you can do that might change it around and it doesn't have to be that way all the time. Or if you're always having this elaborate making love stuff, like try a quickie. Like, just shake it up a little. Like
Yeah,
make it different. Variety is definitely the spice of a sexy life. Like it has to be different. It cannot be the same all the time. And a lot of
for
couples
sure.
fall into that with long-term relationships.
And so it's interesting that you mentioned about like toys, right? So we oftentimes recommend the use of a vibrator, right? I think it's really fantastic, even for blood flow purposes.
Absolutely.
and being able to identify the areas that feel the best, right? Where does it feel good when this vibrating device is up against, my tissue, right? And being
Right.
able to identify, well, what feels great, what doesn't.
Yeah, what pattern?
But
How? Yeah.
exactly. And it actually reminds me, did you ever watch Friends?
Yes. Yep.
The erogenous zones that they were trying to figure out, and it was just hilarious. I love that episode so much. But anyway, just in this conversation, I had a flashback of that
Yeah.
episode.
Yes.
And then 7, 8, 7, 8, when Rachel's
Yes.
going on,
You're right.
trying to help Chandler with how to have a
Like,
good sex life, and they're drawing it.
yeah.
And he's like, "Oh, wait a minute, that looks upside down." And they said, "Well, sometimes it helps if you do it upside down, you know?" So
Yes.
just these tiny little changes.
Yes.
But it's so true. And then bringing in some toys can be exciting and fun too. It doesn't have to be anything intimidating. Like you said, you don't need to install a sex swing by any means. But
No,
hey,
but you
like bringing in
could.
little but you could, yeah. But a vibrator and some little toys can, switch things up a little bit. You don't have to have the same old sort of boring intimacy. Little tiny things will spice it up and
Yeah.
make it feel different.
I mean, honestly, at home, like I always say, like there's something it has to change all the time. Like, and one of the more important things for me, I tell my patients this is like, I don't want to undress myself. Like when it's like a boring transaction, and we're just like, okay, it's time. Like there's nothing less sexy in my brain than like just making it like a business deal. All right, you take your clothes off, I'll take my clothes off, we'll get into the bed.
Yeah,
Like come on,
right.
like undress me. That's exciting in my brain in and of itself. It's like you want me undressed, not I'm getting undressed because we're going to do this thing we haven't done in a couple weeks or whatever. You know what
Right.
I mean? Like,
Exactly. Unless it's
so
a quickie, of course, in
unless
times
it's a
of
quickie, which
factor.
at times like is fun, and I've had a lot of people, and I even did this at my house. Like we installed a lock on our door. We have a lock on our bedroom door. If nothing else, like assuring that someone can't walk in is a safety thing in a lot of people's minds to like let loose. If you've got kids or small kids or teenagers, which will have the bigger issue if they walk on you for some reason in the
Yeah.
middle of the night or at 8 p.m. or however you're
Right.
doing it. So
It could
yeah,
be traumatizing, but hey, it's also an anatomy lesson.
could be, but, like, it'll allow you to do a quickie, if you want to, and it'll take that piece out of your brain that, like, someone could walk in at any time, so you will say yes sometimes instead of no all the time because you can lock the door.
Amazing. So if you have couples that you're working with or just an individual, at what point, once you've had conversations with them, and of course you do a ton of counseling around sex, I mean, that's one of your certifications, but at what point do you say, I think you need to go and see a psychotherapist specifically around this? Like, what sort of signs or red flags would you at what point would you recommend that would be the most logical next step?
There are a lot of, things that kind of, like, flag that, "Oh, you need longer term counseling. Do you need to go more in depth with a therapist who is trained to be a mental health provider?" I tell people that sex counseling is usually more short term and problem focused, and as a medical provider, like I can do a lot of things that other people cannot do, and that has value too, right? Like when it's a dry vagina, like I got you. But if I've found in people that have just like unbearable anxiety that hasn't been dealt with, it permeates every part of their life. You
Absolutely.
need to work on that. Even if it's not the relationship itself, like you need to help find ways to rein in your anxiety so that you can have a rewarding relationship with your partner. And so I've seen people like that. I have seen people who have, not really dealt with some either, I mean, and most adults have, I thank God, have talked to somebody and feel like they've moved past younger sexual traumas or rapes or other things that have happened that were not, favorable to like a life of carefree, fun sex. And so those people, if I feel like, they haven't addressed that stuff or they really admit that like, I went 2 times and sometimes this thought comes back into my head when X, Y, or Z happens. That is definitely a time. Any struggles with like sexuality or changing like your own identity or romantic kind of like interests or wanting to change the relationship or any relationship struggles like needs a therapist, and I recommend a therapist. Like, you can ask him to do the laundry all you want, but if he's not going to do it and he's not going to give you an orgasm and everything's the same and nothing ever changes, you have relationship issues that I can't help. So
For
those are
sure.
kind of the bigger things, like big changes within you, like all of a sudden now you're attracted to women, or you
Mhm.
want to open the relationship and your partner doesn't, or they want to open the relationship and you don't, that needs someone. And honestly, I would argue if it's anything related to your sexuality or your partner's sexuality or the relationship dynamic that is not vanilla mainstream, right? Like not just like you're arguing and you're not getting along. I would highly recommend finding someone who's had some of the same training that I have, but is a certified sex therapist because they
Yes.
have a much bigger wheelhouse and they understand the normalcy and the commonness of this and they have ease at talking about it and they're not going to tell you something that is potentially wrong or problematic because they've had that training. They've had the same kind of training that I've had, sex specific, but then they also their wheelhouse is, long-term mental health counseling.
For sure. No, that's great. That really does help to narrow things down. And I love what you said that typically, sex therapy is a short-term
Sex counseling,
type
yeah,
of
it's a
therapy or sex counseling,
short-term
right?
problem-focused thing, and honestly, if I'm working with pain patients, like, that can be longer term, right? Like, we're thinking about endometriosis surgery,
Mhm.
or we've
For
had to
sure.
try a couple different vaginal preparations to have something that doesn't bother you, but then making sure it's better, or if you need pelvic floor PT and maybe have to learn to use dilators because you've gone, 20 years without a partner and now you're dating someone and you're 75 and you need to, like, allow time for your vagina to, do the things you want it to do. That
Mhm.
is definitely something that stays with me. But if it is something like emotional or argumentative or a fundamental change in a relationship or an identity, by all means, that needs someone with a different skill set, but also similar knowledge.
Yeah. Yeah, that would just focus on that particular issue, but absolutely. And asking someone to do the laundry more or grocery shop so you don't think about that while you're, trying to have, intercourse or sex and or slash intimacy. And they're not willing to, well, that's a whole other ball of wax.
Right.
That's really a fundamental relationship issue that needs more work. But no, that's really helpful. So again, looking at a libido from sort of that physical, mental, emotional sort of standpoint, we've really addressed the issues with vaginal hormones and or lubricants and or moisturizers, really trying to make sure that we're taking care of all that tissue and so that it feels good when the time comes and you're trying to have, an enjoyable time. Looking at the mindset shift again of really just, focusing that it's not something that's happening to us, but rather we're evolving with this change and
Hmm.
looking at our relationships being different because we don't stay in that honeymoon phase forever. And you know what? Thankfully we don't. Like
Hmm.
that's a very positive thing.
Yeah. Absolutely.
And
There's a
I
lot of
mean nobody's got
anxiety
time for
during
that.
that time. Yeah, there's a lot of uncertainty, like, is he gonna be there? Does he really care? Does she really want to spend this time with me? That you don't
For
know
sure.
somebody well. Like, absolutely, it can be so much better in the long term.
For sure. And then with that, the psychological piece too that comes with, our mindset or even our thoughts around sex and how we were raised and all of
Right.
those things, but also that conversation with our partners and ensuring that our relationships are healthy and that we're all on the same page. So that's really, really important. And I'm so grateful for this conversation. As we sort of close up, I wanted to ask one thing here of you.
Sure.
Could you tell us what is the very first step that you would recommend to any woman who walks into your practice? Perhaps your hands on the door and all of a sudden they say, "Hey, my sex drive is low." And your visit's over, but you know that you're going to bring them back. What is the very first step that you would recommend that they take?
Well, my first question is always like, this is bothering you, right? Like, this is a change, or it's always been that way? Because that definitely is, I don't want someone to feel bad for who they are. Because every once in a while, it's like, I've never really been interested. That's
Mhm.
okay. Validating people, telling them that I've heard them. Like, I hear you. This is really common. I love to normalize things, even things that are, people don't think are so normal, the impact play or like, dominance and submission in some way, shape, or form within a relationship. Like, there's a lot of things that are more normal than we give them credit for. So I try to quickly validate and normalize. And I can quickly take a certain, like, how are you feeling about this? Like, is this something that's also a relationship issue? Do you want to talk more about it? But honestly, I just want everybody to know that it's normal. And as quickly as I can get to the bottom of, like, is there a pain component to or not? Is your partner giving you a hard time? Is this something, because, there is always sometimes a component where the partner is being very unkind to someone who's really feeling this way. So I take a safety survey really quickly. But normally, like, I tell them, like, hey, you're not alone. And, even I, get like this, like, this is normal. normal. But if you want to do something about it, I'm glad you talked to me. I want to help you. Like I at least have this skill set. Like you're lucky, because not everybody
For
does.
sure.
But validating and normalizing, because believe it or not, this is normal. Like we don't have to accept it for the way it is, but almost everybody experiences it, especially between age 45 and 65. Like so many women, like that's where the seat of sexual dysfunction lies, which is why, being like knowledgeable about menopause and being a menopause clinician is so important for me in my sexual health work. Because there's so much going on. So, I'll educate them quickly. I usually have a couple things I can put in the electronic record for them to read, but just to acknowledge, to tell them I hear them, that I got them, that we're going to talk more about this, and to normalize it, and then to try to like set up a plan for follow up is kind of my quickie out the door thing. And that's why I've saved a bunch of like little tiny handout things that have like TED Talks, and there's a Netflix series that's fabulous that's about, women's sexual health that I like, like here's like 6 different things if you're interested. It's a book, look at these things, and then like come back and see me because this deserves more time. It deserves more
Amazing.
than
Yeah,
like an afterthought of your annual exam.
for sure. That's awesome. Yeah. So really just encouraging them to come back and have that conversation, right? In a environment that's safe and with a knowledgeable practitioner.
Absolutely.
The
And giving
problem
them
is
some
trying to find someone who,
right,
who
but
knows.
giving them some
Yeah,
tools. But if it's my hand on the door, I'm the one that's saying like, we
absolutely.
can keep talking about this and let me give you a few things that you can start thinking about, and then we'll talk, because I don't want you to, it's such a quality of life thing. I say this all the
For
time. Like, I'm
sure.
not delivering babies anymore. I'm not in the hospital very often. I'm not saving people's lives left and right. But like between the menopause care alone and the sexual health, aspect of my job, I feel like almost every day, I have to keep reminding myself, like, I am helping people's quality of life. And that is just as, I mean, I feel like it's just as important. You don't want to live a life that doesn't have like, pleasure and fun and quality, right? Or that hurts to do the things that you love. Like, I think that's super important. And I feel like it's a gift. And I'm glad there's a lot of people out there who kind of think and know the same things that we do and are out there to help. But yeah, it's,
Amazing.
yeah,
No, you're right, and it really is about quality of life overall because it's a full body experience, it's head to toe. This is not just a singular area of our bodies, it's everything. But if we're talking about a woman who doesn't have access to you or to me, for example, and they're listening to this and they're in the middle of goodness knows where, and they're feeling like their sex life is not where they want it to be. They do want some change because they preferred when they were perhaps more active or they had more of a physical pleasure response when they were having sex. What would you recommend be their first step to changing where they're at?
arm yourself with as much knowledge as you can. And women with the perimenopause and menopause are getting to be very savvy and very good at this. There are resources and places, and you might have to help me with some of the Canadian ones because I don't remember them all off the top of my head. But like, if you look for not only just providers, but resources at like the International Society for Women's Sexual Health or the Menopause Society, which used to be the North American Menopause Society, if you look on like ASEC's website, so the American Association of the Educators, Therapists, and Counselors, you can find not only providers, but you can find resources. Follow
Yes,
doctors or like, learn from doctors or providers who seem to have a good kind of basis of like scientific kind of knowledge when they talk to, but arm yourself so you can like have the intelligent conversation with someone who might not be as well trained as we are, but so that you don't have to set for,
exactly.
someone who doesn't know. Because all of these places that have providers on their websites also have a vast amount of resources. And if something
Yes,
doesn't seem right to you, like something you hear online, it probably isn't. So I hate the term go do your own research, but do your own research in a way that you can then, because you might get pushback from people who don't know. And then I guess if you ask them, well, who knows more about this that can help me? Or do you know someone who can help me? Because
exactly.
it becomes, it's your life. And I don't want you to necessarily have to doctor shop, but if you have to provider shop, like you may need to do that. But be your own best advocate. And I know it sucks, but we're women. We're used to doing all the things that suck all the time.
Sure. Oh, and that's just it. And looking at resources that are credible, like the Menopause Society, for example, and there is the Canadian Menopause Society as well. There's lots of information there, and they can also link to providers who are members within those organizations, right? So there are so many ways of accessing, a provider. But the last question I had for you was what are one or two books that you recommend women read in the realm of intimacy and libido or perhaps just midlife?
There's so
A
many.
couple of your favorites.
I wish we were doing this podcast in my you could see like I have a huge bookshelf of books, but I will give women this permission because like I don't read nonfiction anymore. I audiobook them all. I walk the dog, I listen. When the kids aren't in the car, I listen. I do really for people who are in long-term relationships, and I know people like talk about Emily Nagoski all the time, but I do both of her books, she narrates herself and they're fabulous. The Come As You Are, if you're in a long-term relationship, even of one that's not like, heterosexual, heteronormative relationship, she does try her very best to touch on all of those things, but she touches on how things happen in long-term relationships and ways to refocus away from the desire and up towards the pleasure. And I always add the intimacy, right? Because like if the relationship's important, even the intimacy, even if it's not 100% sexual all the time, is important to get you more apt to most of the time want to be sexual. I love that book. I found it very helpful. I will throw in that I have found a lot of cool things for providers about tell me about the last time you had sex. Like if you are seeing people clinically, and in the same vein, there's also that like She Comes First book script. It has a lot of insights for someone who's actually trying to provide care, even if it's short term, from an oral sex standpoint or from like, forgetting that like sex doesn't need to just be about penetration. So like the whole, clitoral stimulation thing, it's kind of fascinating. Beyond that, I found fascinating. Oh, so I would say I found fascinating Nan's book about the neuroscience of like how we enjoy stuff. It's very multifactorial. But the last thing I would tell people if you haven't read it, The Body Keeps the Score by Bessel van der Kolk. It talks about kind of like our basement brain, like you were talking about, and what happens when you're in fight or flight and how to ground yourself. But it really does legitimize for women, I think, a lot of the stuff that we can't necessarily diagnose, put a name to or a diagnosis to. And I found it just fascinating because it translates into everything like sexually, emotionally, physically. And I just found it uplifting. And I think it's a great book for patients to read just in general.
Amazing. Yeah, that's great. And we are in a world where digital book products are available, whether you read it on a tablet or you're listening to it on your walk or on your drive into work, it's perfect. So
Yes.
we didn't have that many, many years ago. So let's take advantage of it and learn. So I will definitely add in all of those titles and links to the websites on in the show notes. And I will also include your website, of course, if anybody wants to check you out, maybe do some extra work. I mean, Canadian people, maybe you want to drive to Rochester to check out a Dr. Slattery and see what she's up to. But she's pretty busy, so I'm not sure how that all works. But regardless,
And but I want to help people, and I need to devote a little bit more time to getting more stuff on my website because I've written a bunch of stuff that I still haven't published. So I will do better, and I've kind of like dialed back some extra work a little bit so that I have time to do that now. Um,
that's amazing. Well, we look forward to it because you're just a wealth of knowledge. And again, we thank you so much for being on the Hot
it's
Flash
my
Diaries
pleasure.
podcast. This has been so great.
It
And
was
I loved our
fun.
conversation so much. And I hope that our listeners are able to walk away and feel more empowered and really just heard, right? Because everybody
Yes,
experiences some sort of issue with libido at some point. And so really knowing that although it happens, we can really improve things. So we hope that you're walking away or listening and feeling hopeful that change is possible.
I hope
So
so because it is.
yes, it is absolutely. So thank you so much again. And thank you to our listeners. And we hope you have a great day. And thank you again, Dr. Slattery. You've been amazing. Okay.